to our press briefing with COVID-19 updates. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we'll hear updates from our community leaders, and first we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor.
Thank you, Chief. Good morning. The mass vaccination site off Oak Ridge Drive was closed last Friday. GEMA failed to provide adequate instructions to the hundreds of citizens who had received the first dose at that location. This decision was, in my opinion, irresponsible. All those who received the first dose at the mass vaccination site should make reservations to have the second shot at Phoebe Health Works or Phoebe East. There is good news to report. When I spoke 2 weeks ago, I mentioned President Biden's challenge to the nation's governors: offer the vaccine to all adults by May 1st. Governor Kemp announced earlier this week that all Georgians 16 and older would be eligible for the vaccine starting yesterday, more than 1 month ahead of the goal set by the President. This expansion was made possible by the amplified production of the vaccine. The federal government allocates the vaccines to the states each week. The respective states are responsible for adopting plans to distribute the vaccine to hospitals, health departments, pharmacies, and in some instances, mass vaccination sites. As of March 24th, over 46 million Americans had been fully vaccinated. Unfortunately, only 11% of Georgians have been fully vaccinated. In point of fact, Georgia is 48th out of 50 states, with only Texas and Utah having a lower percentage of citizens having been vaccinated. There is a surplus of vaccine in the state. As of March 22nd, less than 70% of the doses allocated to Georgia had been administered. An article in the Atlanta Constitution, citing statistics from the Department of Public Health website, states 20,662 people have been fully vaccinated in Dougherty County. This would be 23% of our population. An additional 9,446 people had received their first shot. These figures may be somewhat misleading, as the numbers almost certainly include individuals from outside Dougherty County who are vaccinated here. Our challenge is convincing those who are reluctant to have the vaccine to be vaccinated. We know that those who are 65 and older are more likely to be inoculated. A poll conducted in February revealed while 68% of adults stated they would probably or definitely be vaccinated, over 85% of senior citizens responded that they would probably or definitely be vaccinated. It is now everyone's turn to be inoculated and thereby protect themselves, their loved ones, and the community. This is particularly true in view of the fact that several variants, some of which are more virulent, have been identified in recent months. The vaccines are safe and effective. Over 90% of those who receive the Pfizer and Moderna vaccines will be immune to the virus that causes COVID-19. There are no serious or life-threatening side effects, and any side effects are temporary. Individuals who are infected should be vaccinated, as we now know that reinfection is possible. The natural immunity which results from infection lasts in some individuals for only a few months. Individuals who have serious allergic reactions to vaccines in the past and those who are pregnant are not being vaccinated. Anyone who is tested positive should wait 90 days from the last positive test to be vaccinated. I would again recommend that those who have reservations about being inoculated consult with their primary care physician. While I understand this is a personal decision, we need to take advantage of this opportunity to combat and finally contain the virus, which has ravaged our city and country for more than a year. Thank you.
Thank you, Mr. Mayor, for your comments today. Chairman Kohelis cannot be with us today. However, standing in for him today, Wendy Howell, who is the Public Information Officer for Dougherty County. Ms. Howell.
Thank you, Chief. Chairman Kohelis sends his regrets today. Just want to go over a few numbers, our data for this week. We're continuing to see a downward shift in the number of positive cases. We're now about 3%, which is incredible, and we want to thank all of our citizens in our community for your consistency with taking all of those precautionary measures to help us keep those numbers down. Now, I want to focus on the vaccinations being received in the community. As you know, the GEMA site shut down on last Friday, but we're more than prepared with providers we have right here in our community to administer the vaccine, and I want to go over those with you today. We have Phoebe Putney administering the Pfizer vaccine. So for those citizens who received their first injection at the GEMA site, you can go to Phoebe, call 312-1919 to schedule your appointment. We also have Dougherty County Health Department, and we have Albany Area Primary Health Care. We want to thank all of those providers in our area for continuing to serve our citizens. I also want to provide some information from the Phoebe vaccination site. Just sharing this, I'm sure Dr. Black will share some more information with us today, but they have plenty of available appointments, ample vaccine supplies. It's a quick and easy process, and we urge all of our citizens to take advantage of this opportunity to get the vaccination. So just a reminder, even if you receive the vaccination, we still urge you to wear your mask, social distance, and wash your hands. Protect your family, your friends, your co-workers, and your community by getting vaccinated and continuing to take the precautionary measures necessary to protect all of us. Thank you all and have a good day.
Thank you, Ms. Howell, for standing in for the chairman today. It's great to have you with us today. Next, we'll hear an update from our representative from Phoebe Putney Memorial Hospital, Dr. James Black, who is the chairman of the emergency department. Dr. Black.
Thank you, Chief. Mayor Durrell. So as of this morning at Phoebe, in our hospitals, we have a total of 28 COVID patients, 25 at the main campus and 3 at our Americas campus. After more than a month of a pretty sharp decline, our numbers have started to level off a little bit over the past couple of weeks. But although that's encouraging, it's a clear indication that we're not done yet, okay? We've made some significant strides, but I want to emphasize we are not done. We know that everybody's anxious to get together for Easter and spring break holidays, and also making plans for that big summer vacation. I'm not telling you not to do these things. I'm saying don't be reckless, okay? Still take the precautions and be careful. I think we can still be smart about the things that we're planning on doing. If you haven't been vaccinated yet, it's time to roll up your sleeves. We have, there's no excuses. We have plenty of vaccinations available. The governor has opened up to all Georgians who are ages 16 or above, and you can get the vaccine at no cost to you. So we're running out of excuses as to why we haven't been vaccinated yet. We have ample supply of Phoebe, and even with the closure of the state site, the vaccination site in Albany, and even with the expansion, we are well poised and we have available appointments. So make sure you call 229-312-1919 in order to make that appointment. We've seen a moderate increase in that call volume, but not as much as we had expected or hoped for. So make plans to get the call out and get vaccinated. Everything's as easy as possible. There are multiple vaccination sites. We are open, I think almost all of our clinics are online to give the vaccination, and the next two will be online in the next several days. So at all of our facilities, we're able to get you vaccinated. Cancer patients are being offered a vaccine during their appointments when they come to the Phoebe Cancer Center for the routine checkups. For 16 and 17-year-olds, come to the main hospital because that's where we have the Pfizer vaccine, and that's the vaccine that's been approved for those ages. So over 18, you can go anywhere else. If you're 16 and 17-year-old, make an appointment with those places. This week, we were pleased to have the governor come down and help us with unveiling our two new mobile health units. They're going to be hitting the roads throughout Southwest Georgia, and they're going to be actually utilized to get the vaccine out to places where people might have challenges getting in or to those remote areas. So look forward to seeing those. And bottom line from all of this is there's no excuse for you saying that you cannot get vaccinated at this point in time. I think we've all enjoyed seeing the numbers come down, but the fact of the matter is 1,270 people died yesterday from coronavirus. We are not done yet. Even though you have been vaccinated, continue to do those things we continue to preach. Wash your hands, maintain social distancing whenever possible, and wear your mask. All right, just because you wear your seatbelt in your car does not mean you don't obey the traffic laws and pay attention. So just because you've been vaccinated does not mean that you stop doing those things that have been able to help us get through this pandemic to this point. So thank you very much and enjoy your weekend.
Thanks, Dr. Black. We will now hear from the Director of the Southwest Georgia District of the Department of Public Health. Dr. Charles Ruiz is here to make some comments and provide an update. Stand by just a moment, Dr. Ruiz.
Thank you, Chief, and good morning, everyone. There's lots of good news, good numbers to report. One of those is the 14-day new case rate, and for Dougherty County, that number is 67. That's 67 cases in the past 14 days per 100,000 people. About 3 months ago, that number was about 10 times what it is now, so that's to be celebrated. However, I do agree with Dr. Black that this pandemic is not over yet. People are still getting sick and still getting hospitalized, and unfortunately, people are still dying from COVID-19. So it would behoove us to re-examine where we are and where we've been and consider where we want to go and consider those things that we can do to obtain the best outcomes in the future. One of those is, of course, getting vaccinated. And it's great that Governor Kemp is now allowing us to vaccinate all adults and those who are 16 and 17 as well. In Dougherty County, Public Health has administered over 7,500 COVID vaccines. About 40% of those are fully vaccinated. And throughout the 14-county Southwest Georgia Health District, we have vaccinated over 48,000. It's easy to make an appointment for a vaccine, and there's lots of places to go. One of those is Public Health. We have a call center that's open 5 days a week, and that number to call is 229-352-6575. You can also call the Dougherty County Health Department on South Slappy at 229-638-6424, 638-6424, and you can make an appointment. The vaccine is free and the vaccines are abundant. In public health, we are primarily using the Moderna vaccine. The Johnson & Johnson product is very limited at this time, and we're primarily using it for nursing home patients and people who have very significant problems with ambulation or transportation. But in weeks to come, we hope that the Johnson & Johnson product will be abundant to the point that we can offer the choice to all patients. It's still very important to get tested if a person has symptoms that are consistent with COVID-19. In Dougherty County, we still have the option to be tested at the fairgrounds. However, what started as 6 days a week has now gone to 3 days a week, and it's simply because of the demand for testing. It has gone down in proportion to the number of cases that we have. But you can still go to the fairgrounds and get tested on Monday, Wednesday, or Thursday. The best way to do that is to pre-register, and if you do so, then you can go and get your test done at any time on that day. To connect with the MACO, that's the name of the company performing the test, you can go to the Southwest Georgia Public Health website, and you will see a link to MACO. You'll also see a QR code that you can scan, and you can register, and they'll be waiting on you when you get there. That's Monday, Wednesdays, and Thursdays in Dougherty County. 2 days a week, MACO will be in Colquitt County performing tests every Tuesday and every Friday from 9 a.m. to 3 p.m. This is the same MACO that's here in Dougherty County. They're just here 3 days a week, and in Colquitt County 2 days a week starting next week. That location will be on Park Avenue in Moultrie, Georgia, at the Gladys Espy School Complex. So until the end of this pandemic, it's going to be very important that we continue to make wise choices and to act responsibly. And that includes social distancing. It includes wearing masks when we can't properly social distance. It includes hand washing, and it also includes staying home when you're symptomatic and getting a test. So if we'll all do these things, there's a very good chance we'll see these numbers continue to decline, and at some point, we believe we will have control of this virus. Thank you very much for your cooperation.
Thanks, Dr. Ruiz. We now hear from the Dougherty County Coroner, Mr. Michael Fowler.
Good morning. It's a great day to be in Dougherty County now. Things are, as they said earlier, just trending down, and I'm glad. I want to thank the community, the different ones that have been wearing masks, doing what we needed to do. I want to thank the ones that have taken the vaccine. I want to encourage the ones that have not. I think it's a very important thing that we need to do in moving forward in our community. I'm going to go with a few of the couple of the numbers, then I want to go into something that my office has been getting quite a few phone calls about. But it says, as of March 26, 2021, there have been 277 deaths that have been reported from the residents here in Dougherty County. There has only been 2 deaths since the last time we reported. The last time we reported, March the 12th, we had 275, so we've had 2 more COVID deaths. So we're at 277. I do not want to reach 300. I do not want to reach 300. Death per month, as of January this year, we had 41 deaths. As of February, we had 17 deaths. As of March, at this present time, we just have 5 deaths. We're on the rate, trending down, like we said. I wanted to get down to 0, that I don't have to come up here at all. We wanted to get it down to 0. I want to talk about one of the things that different ones have been calling my office about, and also the funeral homes about, that FEMA have working toward helping families that had COVID-19 that died from the virus. FEMA is helping funeral costs of COVID-19 related death. Beginning in early April this year, FEMA will provide financial assistance for funeral service. The program is called COVID-19 Funeral Assistance. Different ones are calling my office trying to find out what they're entitled to. I know during the beginning of the virus, many people did not want COVID-19 written on their death certificate. Felt like something that should not be put on there. They didn't want that on there. But now people are calling wanting to put on there because of the money they can get. Who is eligible for this money? An individual or individuals who have contributed to the funeral service. The applicant must be a U.S. citizen, non-citizen national, and qualified alien who paid for the funeral. Incurred funeral expense January the 20th of last year for a death due to COVID-19. The death had to be incurred in the U.S. What is covered? These funds will pay up to $9,000 per funeral and $35,500 per applicant. When it's saying per applicant, that means you might have had 2 deaths or 3 deaths in your family. It would pay up to $35,500, but it'll pay up to $9,000 per funeral. It will pay for the transportation for 2 persons to identify the deceased person, transfer of the remains, the casket, the urn, the headstone, the marker, the burial plot, the clergy, officials of the service, the funeral ceremony, the one to make the arrangements, the equipment that was used at the funeral home, cremation. These are the things, and the death certificate. These are what the funds will cover, those items. What is not covered, this is very important, duplication of benefit. FEMA will not pay benefits already received from burial and funeral insurance, non-profit or government agency. But life insurance, many people have been calling my office about life insurance. Life insurance proceeds are not considered a duplication of funeral assistance benefit. This means you can have life insurance and still be qualified to receive the benefit. So it's not like a GoFund or a Vital Assistant or someone gave you the money. That's different. But with life insurance, you're still entitled to the funds. Document that would be needed. This is a form of a death certificate. Official death certificate is going to be needed. A list of COVID-19, maybe the cause of the death, or maybe some symptoms of the death, a result of COVID-19. You may have pneumonia, then COVID-19. You may have hypertension, diabetes, or cancer that died, and you still had COVID-19. It have to be listed on the death certificate. People have been calling my office how to get a death certificate amended. Many people did not want COVID-19 on their death certificate. Now they're contacting the person. Contact the person who certified the death certificate. So that's how you get a death certificate amended. If it was not on there, you feel your loved one had the virus, or you know he had or got documentation they had the virus that was not on their death certificate. This may be the attending physician or the one that was treating the person, the coroner or the medical examiner whose name and address is on their death certificate. Applicant may provide some kind of documentation to that person that they should have proof that that person had the virus or had those symptoms. The death certificate can be amended. Documents that are needed: a receipt, funeral home contract, the deceased person name, the amount of the funeral expense, the date and the funeral that was held, and also proof of funds that you received from, not necessarily from insurance, but you got to have proof of insurance. I mean, the different sources that helped pay for the funeral service. Information that's going to be needed: Social Security number of the applicant and the deceased person, date of birth of the applicant and the deceased person, current mailing address of the applicant, the telephone number of the applicant, location and address of the deceased, burial and funeral insurance policy, any kind of others, like I said, care grants or funds that you receive, and a routing account number so they can deposit the money into your account. Those are the things that are going to be needed when you go on the site and start filling out the paperwork. If several people contribute to the funeral service, your funeral expense, they should apply on that. One applicant need to apply. One applicant need to apply. And you can put down a co-applicant because members of family member may help pay for the funeral. So you got to have co-applicant. You got to use one application. You can't use, everybody got to fill out an application. No, one application, and you can be a co-applicant. An applicant may apply for a multiple deceased person. If you have more than one person to die in your family, you can apply for each one of them. FEMA is working to establish a toll-free number. That will be coming out in April too. The website, this is the website that you can apply for. And like I said, a phone number will be definitely coming out so you can go online and apply. You gotta have those documents. You gotta have the death certificate with COVID-19 written on it. I wanna encourage you again, the ones that have not received the vaccine, I would just wanna encourage you, I've had the vaccine and I'm still alive. I encourage you to do that. I wanna encourage you to mask up. It's so important to keep masking up. I wanna thank the ones that do take time when you go into the stores or go to different functions in the public. You do wear your mask. I want to encourage you to keep doing that. But again, one death is too many. But we want to get down that I want you to have to come up here no more because the death have stopped. Thank you.
Thank you, Mr. Fowler. We'll pause now for questions. Okay. Well, we'll ask that you join us here for our next press briefing. It will be on Friday, April 9th at 10 a.m. We'll see you then. That concludes our press conference. Have a great day.